All right, so chapter 34, fluid volume excess. So we're going to get into diuretics. Um, don't really need to look any of this. Like, obviously, you're going to be given if you have like edema, um, cardiac, renal, hepatic, burns, trauma, allergies, inflammation. Okay, so number one, loop diuretics, furosemide. Um, Others in this class, ithacryonic acid and bumet, bumen, bumetanide. I don't think we're going to need those, but furosemide, that's the one you're going to know. Lasix, that's what you're going to hear it called in a hospital or clinical setting. I've never heard of furosemide. I've heard of Lasix like a million times. So expected use with antihypertensive management of acute pulmonary edema, heart failure, as well as hepatic and renal disease. So it might be given with an antihypertensive like one of those ACE inhibitors or something else we talked about earlier. Why? It's going to cause you to get rid of all the excess fluids that help cause hypertension. So, expected action. So, again, we have all these highlighted. Inhibit sodium and chloride reabsorption in the ascending limb of the loop of Henle. Increase excretion of water and potassium. So it is not potassium sparing. There's only one potassium sparing, and this is not it. So, again, expected action is inhibit sodium and chloride reabsorption in the ascending limb of the loop of Henle. Is it Henle? Henle? Whatever. Who cares? Uh, Increase excretion of water and potassium. Where sodium goes, water follows. So it's kicking out sodium or not letting sodium back in after it's been filtered out. So adverse side effects, fluid and electrolyte imbalances. So hyponatremia, hypokalemia, fluid volume deficit, and then autotoxicity. Divide dose, rash, photosensitivity, renal failure. I think divide dose probably needs to be down in nursing considerations. Rash, photosensitivity, renal failure, headache, hyperglycemia, muscle spasms, hypotension. Oh my gosh, it's 12:43. Ugh. Sorry. Sorry. Headache, hyperglycemia, muscle spasm, hypertension, GI upset, and weakness. Cautions, contraindications, sulfonamides, pregnancy, anuria, electrolyte imbalance, gout, whatever DM is. Probably no, but I'm very tired. Liver, myocardial infarction. Okay. Nursing considerations. You give this in the IV, you're going to give it slowly 4 milligrams per minute to prevent autotoxicity. Okay, that one's highlighted. Again, if it's IV, you give 4 milligrams per minute to prevent autotoxicity. That's why I also have autotoxicity highlighted in adverse side effects. It's going to cause diuresis within 5 to 10 minutes. Monitor blood sugar, blood pressure, vertigo. Take with food. Tablets can be crushed, so don't know if that matters, but they can be. Take early in the day. That seems to be a recurring thing here in the diuretics. Weigh daily, and then encourage potassium in the diet. Monitor blood pressure and eyes and nose, which both of those seem to be, again, and weighing people. They all seem to be recurring themes here in diuretics. So, big ones, give slowly 4 milligrams per minute to prevent autotoxicity, and encourage potassium diet because it gets rid of potassium. Next one that gets rid of potassium is thiazide-like diuretics or hydrochlorothiazide. And if we go all the way back up here to the top with our ARBs, valsartan hydrochlorothiazide. So, again, it's one of those ones that we're going to have paired with a antihypertensive. It's going to help the antihypertensive by getting rid of excess fluid. So expected use mild to moderate hypertension and edema associated with heart failure and nephrotic syndrome. Um, so, oh my God. Sorry again. It's edema that's caused by heart failure and nephrotic syndrome. So it's getting rid of that. So it's going to help lower blood pressure. So expected action: decrease absorption of sodium, water, chloride, and bicarbonate in the distal convoluted tubule. Increase excretion of water and sodium and potassium. Okay, so bananas again. I don't really have a lot highlighted here, so we'll see, but just going to run through adverse side effects: hypotension, weakness, dizziness, diarrhea, constipation. Wow, diarrhea and constipation. Electrolyte imbalances, all those again. Hyperglycemia, paresthesia, erectile dysfunction, uric acid increase, photosensitivity, blurred vision, and confusion. Cautions, contraindications: thiazides and sulfonamide-derived agents, or renal decompensation or anuria. Okay. Nursing considerations: monitor for electrolytes for cardiac reasons. So again, if we have too low of potassium, that's going to have implications on heart function. So that's important. It takes 2 hours to work and works for 6 to 12 hours. Monitor blood sugar, blood pressure, and vertigo. Take with food. Tablets can be crushed. Take early in the day. Weigh daily. Encourage potassium in the diet. Monitor BP, eyes and nose. Basically the same thing that we just talked about here with loop diuretics. You have thiazide diuretics. Nursing considerations are almost identical. So, okay, so this is our potassium-sparing diuretic, spironolactone. Expected use: heart failure or ascites, which is liver disease, hypokalemia, hypertension, primary and secondary hyperaldosteronism, and then acne is just thrown in there for whatever reason. It works on acne, so that might be something we see because it was mentioned, and so that's why it's highlighted. So spironolactone, potassium-sparing diuretic, can be given for acne. So expected action: inhibits mineralocorticoid receptors and blocks the effects of aldosterone, a hormone secreted by the adrenal cortex in the renal tubules. Increases sodium excretion and low H2O excretion. So again, inhibits mineralocorticoid receptors and blocks the effects of aldosterone, the hormone secreted by the adrenal cortex in the renal tubules. Increased sodium excretion, low water excretion. Adverse side effects: dizziness, headache, abdominal cramping, diarrhea, menstrual something, doesn't say. Testicular atrophy, not good. Which we'll get into that now that I notice that. Tumorigenic with toxicity, hyperkalemia, hyponatremia, impotence, anorexia, tinnitus, and rash. Cautions and contraindications: renal insufficiency, and then first trimester of pregnancy, anti-andronergic. So first trimester pregnancy is a no-go. Here's why I looked it up and why the testicular atrophy now makes sense. This particular diuretic blocks the pathways of testosterone, supposedly, and if you take it and you're having a boy in the first trimester, it will cause the underformation or malformation of the male genitals. So testicular atrophy also makes sense. If it's stopping your testicles from doing their job, they are like any other organ or muscle, they will also shrink. So there you go. That's why that makes sense. Nursing considerations: take with food, weigh daily. Again, avoid potassium here. This is the first one you're going to avoid potassium because, well, it's sparing it. So take it in the morning, just like the rest of them. Diuresis 24 to 48 hours. Avoid salt substitutes because a lot of them have potassium in them, and then monitor blood pressure and eyes and nose. So there you go. And then here's the last one is an osmotic diuretic, mannitol. So really the only one thing that was mentioned for mannitol is reduction of intracranial pressure. So if somebody's had a head injury and they've got swelling on their brain, like this dude over here, it's going to help drain those fluids out and get rid of them. But I'll go ahead and read the whole expected use. Expected use for mannitol, or which is an osmotic diuretic, is managing oliguria or anuria, and may prevent acute renal failure during prolonged surgery, trauma, or infusion of cisplatin, an anti-neoplastic agent, reduction of intracranial pressure, highlighted, and then excrete toxic materials. Expected action, rapid diuresis by increasing osmotic pressure, solute load increase. Water will be pulled from the extravascular sites. So again, rapid diuresis by increasing osmotic pressure. Water will be pulled from extravascular sites. Adverse side effects: pulmonary congestion, fluid and electrolyte imbalance, acidosis, electrolyte loss, dryness of mouth, thirst, marked diuresis, urinary retention, edema, headache, blurred vision. Those are the adverse side effects. Caution, contraindications: ICP, edema, hemorrhage, which is intracranial pressure, edema, and hemorrhage. Dehydration, anuria, pulmonary edema, and renal impairment. So those are cautions, contraindications. And then nursing considerations, interventions and teachings: monitor blood pressure, intracranial pressure, and neuro changes. That's highlighted, something you're going to want to monitor. And then eyes, nose, and electrolytes. So that's it for the diuretics. And then I'm going to do the one last video for tonight is going to be over lipids.